Hello everyone, this is Chadi Alraies from RSH 2025. A privilege to be with Dr. Misbahul Ferdous to talk about a very important topic, especially for a patient coming nowadays for TAVR with CKD. Dr. Ferdous, thanks so much for being with us.
Thank you, Dr. Chadi, for giving me invitation for the third Riyadh Structural Heart Conference. I'm very happy to join with you. So today, actually, we will discuss very important topic regarding the zero contrast TAVR.
Yeah.
And I'm from the National Center for the Cardiovascular Disease, Beijing, China, and I'm the Vice President of Asian Society of Cardiology. So we have a lot of data last 6 years from 2018. We did one-stop service for the patient who have the CAD and who have TAVR. So we do together and in one setting. We not distribute patient for the only for the PCI and only for the TAVR. So because of the some patient we receive with the high CKD, and some patient we came after the CT angio, they have the allergic reaction. So we cannot use the contrast for the TAVR. So what we can do, we have PCI done by the IVAS. So this is very common technique. It's not a new technique. But the zero contrast TAVR is one of the challenging, because I think ultimate goal of the TAVR or no matter PCI is the patient less complication after the post procedure. So we saw many patients after the post procedure who have the at least CKD. They have the high creatinine and many trouble. So how to reduce this? We find the common technique. Many people publish in the different journal. Number one is we use the first of all uh, two pictal catheter. So one is a non-coronary cusp, and another one we put in the right coronary cusp. So the non-coronary cusp we can put with the TAVR system, and another one we can use either right radial or above the right femoral main puncture site. So after we put the right coronary cusp, and before we right coronary cusp, we put the first the non-coronary cusp. We have the very clear idea about the alignment. How we can get the alignment? After we put the non-coronary cusp, there is a very shiny area by the lifted by the aortic valve because of the calcium. So is one of the marker for us, the level, annular level. So we put the non-coronary cusp to see the annular level of the by calcified lesion of the non leaflet, and at the same time we put the right coronary cusp to align the level.
Yeah.
Once we find the level and we have the clear idea with the some number, which lumbar, so we have the clear also the CT non-contrast CT also give us a very clear idea, not clear, at least give us some clue where actually the size, where actually the annular position. Then we take out the right coronary cusp, that pictal catheter. Then we put the normal TAVR system, and once we find the annular sizing and our pictal catheter in situ, then we open the valve, and we did a tremendous great job. And the post procedure TAVR really less complication in compare with the other patient.
Yeah.
So I strongly believe maybe after 5 years or 6 years later, we will use less and less contrast for the especially for the TAVR procedure.
With this technique, do you use self-expanding valve or balloon expanding valve?
Self-extend valve also we are using, and the
Any reason why?
I mean,
Uh,
like a, like a balloon expanding valve is good, but I think the self-expanding valve we have the now in made in China, like a 2 to 3 company, they have the self expanding valve with the recapture technology. So I think positioning is very important. So once we have the recapture technology, I can adjust according to my desire if any position we put and we pull up. So it give us the very clear message for the doctors what is the annular size and the angle, angio angle. So I think the recapture technology and the self-expanding valve is the future actually
Absolutely. Yeah.
also. And also we have some great news, like last month we finished one clinical trial for the dry aortic valve for the TAVR. It's coming, not in the coming the market. We just finished the clinical trial. So the ultimate result is zero contrast TAVI really reduce the post procedure complication.
Absolutely.
And I strongly believe, like many young doctors also from Middle East region, from Asia, especially from the US side, they already published some data, 60 case, 50 case. I think day by day more and more people can engage and can get the clear idea how to do the non-contrast TAVI.
Yeah.
Thank you.
Now, the last question is about when we do CTA or you do coronary for the sizing of the valve, but also for the peripheral angiogram.
Full.
So how do you size or make sure the iliacs or the femoral arteries are okay for that patient before you start the procedure?
Oh, before the procedure, we have the full CT report.
CT, okay.
Full. Because without the CT is the actually the 60 to 70% give us the idea. And with the confidence, we can say another good news, we develop our AI system. It's not published in the anywhere. We develop our own AI system for making the size, making the puncture site. By the AI, at least 80 to 85%, they give us a very clear idea. And we put that AI system more than 3,000 data. Okay, so also give us some advice, especially CT, AI, two pigtail catheter, non-coronary cusp and right coronary cusp. Total, actually, the TAVI procedure means total idea.
Yeah.
The total idea give us more confident for the size when we can do the recapture,
Yeah.
positioning up and pull. So as a whole,
would you do a TE with the procedure or no?
I think more than 50% case we did the
You don't.
We did the TE.
You did okay.
Yeah, more than 50. But last 2 to 3 years we are doing the TE as well. But before 2020, we are habituated with the TE only.
Right.
But after 2020, we are okay with the TTE.
Right.
Because more and more expertise, more and more confident level grow up with our
Exactly.
actually team. Thank
Exactly. Yeah, the more you do. Well, congratulations again for the registry that you are building, especially for a challenging cohort of patients that have CKD, that are going for this complex procedure. But this is great technique. We cannot wait to see the publication, so at least we can, a lot of centers will benefit from it. Thank you, Dr. Ferdous, for your time. And watch these videos and others on the YouTube channel. This is Chadi Alraies coming to you from RSH 2025. Thank you so much.
you, Dr. Chadi.
Yeah.
Thank you.